Good morning, guys. I hope we're all sparkly. It's a big decision to commence testosterone replacement therapy, but don't be afraid of deciding it's in your best interest if you've taken a step back and looked at what you're trying to achieve. Are you simply trying to achieve reversal of your negative symptoms? Well, number one, are all your negative symptoms as a result of low testosterone, or is it because you want to be the best version of yourself? Now, it probably starts off with the former, but evolves and progresses into the latter because it should. We should always be trying to be a better version of ourselves. So don't jump to the diagnosis, but in the same breath, don't be afraid, because whilst we should consider this a lifelong therapy, you can come off and you will recover over time to where you are right now. But if it's in 5 years' time, to where you would be in 5 years' time. Now, that's not to say it's always that simple, because life isn't always that simple. So don't jump on TRT if you don't clinically need testosterone. You need the negative symptoms, you need the blood test to confirm there's a deficiency, and look to exclude reversible causes, and do your very best to optimize your sleep, your stress, your nutrition, and your exercise, and your mindset. But as we said in the previous video, you can't outthink your physiology. Your physiology will positively impact your psychology, and your psychology will positively impact your physiology. But it is down to the chemicals in your body and your subjective appreciation of subtle change in physiology. So we talk about the base being the hormones, we talk about the middle layer of the triangle being your nerves, and then the top part of it being your brain, and your consciousness surrounds the whole thing. And you are in charge of your journey. So don't be persuaded to go on testosterone replacement therapy. Do it because you have shown due diligence, read around the topic, and thought, right, this is in my best interests. Because if something sounds too good to be true, no prizes for guessing it's too good to be true, because it's too good to be true. It's quite logical, isn't it, really? But yeah, we had a patient in the other day. He had a very, very protracted journey to come to the men's health clinic. And he wasn't wanting to do daily injections, but he plucked up the courage and said, yes, I'm going to do daily injections. I've done a video about this before. It's just a little prick. And honestly, it is essentially painless. And it's about not thinking about testosterone replacement therapy, because I don't want you thinking about it. I want you concentrating on living. And that should be your primary focus. Now, your testosterone deficiency is likely as a result of lots of things, and it's the end point. So look to address all those things that could be contributing to your low testosterone, because now you're on testosterone replacement therapy, and all those positive things that you're about to put into place will now work, because the hormones are the base, the nervous system sits above that, and then the reactive brain above that. So you're in charge of your journey. So be the best version of yourself. So this guy incredibly worried about doing daily injections because of a fear of injections. Now, if I come towards you with a needle, what should be your reaction? It should be fight or flight. So you have a sympathetic dump, don't you? If you're a more primitive individual. I'm not saying this guy's primitive, but as in, if you were a base animal, you'd be deciding, do I need to fight or do I need to flight? Now, if he needs to flight, what's he going to do? He isn't going to go sympathetic, 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 fight, flight. He's going to go, actually, I need to use my parasympathetic nervous system to have a more considered approach to how I'm going to tackle this horrible man coming towards me with a needle. So how's he going to do that? Well, again, breath. That combined with the brain. Now, if you've been predisposed to having a needle phobia or anxiety about something, because really, what is anxiety? It's unresolved nonsense. Because what's important right now? Right now. So if I'm coming towards you with the needle to say, take blood, it's for the greater good. And we do things for the greater good all the time. So this shouldn't be a worrying thing, but I am coming towards you with a needle. So yeah, you can perceive that as a threat, but your brain and your nervous system and your parasympathetic nervous system and your hormones should allow you to be considered. But with low testosterone and that chronicity having gone, yeah, you're going to be more reactive because you've only got your counterbalance of the acute nervous system, not the considered hormones. So yeah, it's potentially a normal reaction. And everybody's shoulders drop after I give them the first injection. I can tell you it's painless, but until you experience it, you're still going to have that pent-up anxiety of the future. And what are we doing? We're living in the now. So this guy had arranged for his doctor to do the injections, his daily injections. So he came in the next day because he saw Sean the day before. He came in because he needed to have his injections. And so we had a very frank discussion about why he needs to do his own injections, take control of his health because he's in charge. And his fears are unrealistic. And he recognized that, obviously. So if you recognize that your fears are unrealistic, you try and solve the issue. Now, his solution was to get his doctor to do the injections, which was utterly absurd. So we had a very frank discussion. We had this discussion about hormones, nerves, reactive brain, about the polyvagal theory, this understanding that it's not just the sympathetic fight-flight, parasympathetic rest relaxation. You do have a dorsal vagal part of the parasympathetic system, which if you have a sympathetic overdrive and you're facing certain death, then you collapse and you essentially just shut off everything and you just have blood going to the major organs. Because if you're facing certain death, it's certain death. But there's always the opportunity or potential to survive because it's never over until it's absolutely over. So you do have the potential. So you shut down. So we had a very frank discussion. I got him to do the preparation. I got him to hold the needle, but he couldn't do it that first time. So I did his first injections. So he was going home to Italy the day after. So I said to him, right, you've done incredibly well. Again, positive reinforcement. You don't go, oh, why can't you do injections? It's like you have to rationalize with somebody because base animals, they just get on with it. They fight, flight. Us use this. And if you've built this up to be a big thing, it can be quite scary, but it shouldn't be, should it? And you know exactly. Prime example, a little kid, 8 years old, diabetic, just gets on with it. So you've built up all this nonsense and we need to get rid of all this nonsense by going back to what? Basics. It's all about going back to basics. That's the key to life, isn't it? Understanding the fundamentals. All this nonsense is nonsense. So concentrate on the now. Concentrate on the greater good because it's in your best interest. So the second day, I said to him, right, it's all down to you, Chief. And he did his injections. I said, listen, nothing's going to happen. I'm with you. Literally nothing is going to happen. You have to take control. You're in charge of your own destiny. So he did his injections. The first one was a little bit of a skewy one. I didn't tell him because I wanted him to have that positive reinforcement. And the second one, when he did his testosterone, was perfect. Pinch, insert, release, inject. Pinch, insert, release, inject. Remove the nonsense. The nonsense is the nonsense. Well, what about this? What about this? What about this? It's all utter nonsense. So concentrate on what? Concentrate on now. Now, we spoke about that in the last video, didn't we? About concentrating on the now being difficult because you've got low testosterone. So we said again, you've got to trust the journey. You've got to trust me because I will always act in your best interest because there's no incentive for me not to act in your best interests because I am your advocate. I'm not a patient advocate. I'm not a case manager. I'm not trying to sell you on any concept apart from the best. What would I do? Microdose testosterone replacement therapy. On the internet, there's lots of experts who talk about, try this, try that. No, start with the most effective way of prescribing testosterone replacement therapy because they all say, well, if that doesn't work, we'll go to more frequent injections. Well, why don't you start at more frequent injections? Because if you're getting side effects with less frequent injections and you don't get side effects with more frequent injections, does that not point to the fact that more frequent injections is more effective because you're not getting side effects? How stupid do you have to be? I don't want you thinking about, is today my injection day? Every day is your injection day. You wake up, you pin, you brush your teeth, you have a dump. You know, you do these things as a matter of routine, and it should always just be a matter of routine to allow you to go and concentrate on living a life worth living, which means earning your reward.